The Cornell Medical College conducted a study in Haiti about the spread of HIV through sexual partners. During this study, the non-infected partners were not informed that they had a chance of contracting the virus from their HIV-positive sexual partners. Meanwhile, the HIV-positive subjects were told that they would receive treatment for HIV. However, not all positive patients received this treatment, and those that didn't necessarily receive the best possible treatment for the virus, as they were led to believe they would. The Cornell AIDS study is unethical. The principle of beneficence states that physicians have a duty to do what is best for their patients. The Cornell AIDS study does not allow for what is best for their patients. The HIV-positive patients are not receiving the best possible treatment for HIV, and the HIV-negative patients are not informed about the status of their HIV-positive partners and the risks of contracting HIV from their partners. Therefore, the Cornell study goes against the principle of beneficence. The principle of non-maleficence states that physicians have a duty to cause no harm to their patients. Not informing the HIV-negative partners in this study causes harm to them, because they have a very real chance of contracting HIV from their partners. Thus, the Cornell study goes against the principle of non-maleficence. According to Tomasma, truth-telling is a right, a utility, and a kindness. Truth-telling requires the physician to disclose all relevant information to the patient. The physicians and researchers did not disclose all relevant information to the patients in the Cornell study. They did not inform the HIV-negative partners about the risk of sleeping with an HIV-positive partner. And not informing these HIV-negative partners undermines their autonomy. In order to be fully autonomous, a patient must be fully informed, and these patients were not. Therefore, the Cornell study goes against the principles of both autonomy and truth-telling. Utilitarianism is a moral theory that states that the choice that maximizes the amount of good and minimizes the amount of bad for the most amount of people is the moral choice. Some could argue that this study is for the greater good, because the research found in this study could give us knowledge to benefit countless people. If knowledge attained from this study could lead to a vaccine and/or a cure for HIV and AIDS. However, the Cornell study causes great harm to its subjects, such as the HIV-negative partners not being informed about the risks. The subjects in this study receive very few benefits from the study, such as the HIV-positive partners receiving inadequate treatment for HIV. So although the study could benefit numerous people, if knowledge from this study led to a vaccine or a cure, the benefits of this don't outweigh the harm that is done to the subjects. Kantian ethics states that people should be treated as an ends in themselves, not a means to an end. In the Cornell AIDS study, the patients are treated only as a means to an end. The patients in this experiment are essentially being exploited because there is a lack of informed consent. Therefore, the Cornell study goes against the principle of Kantian ethics. Because the study goes against the principles of beneficence, non-maleficence, autonomy, truth-telling, Kantian ethics, and utilitarianism, as we have argued, the Cornell AIDS study is unethical.